Moving along now, and in today's increasingly connected world, we're becoming more aware of the links among human, animal, plant, and ecosystem health. The University of Nebraska-Lincoln's Institute of Agriculture and Natural Resources One Health initiative seeks to bring together people with diverse backgrounds, skills, and perspectives to improve the health of humans, plants, animals, and our shared environments.
So Liz, thanks for joining me.
Sure.
So why don't you just give me an overview of the One Health program here at UNL and some of your partners and how that's going?
Okay, sounds great. Well, thanks, Derek, for the invitation. So One Health is based on the idea that the health of people, animals, plants, and our shared environments is interconnected. And we could think about diverse types of animals, domestic animals like our and food security from local to global levels. So if we think about diseases that can move from animals to people, whether it's from wildlife or domestic animals, it's influenced by lots of different scales. So everything from the level of the individual person and how our immune system responds to a disease, to the local level of where we contact other animals and people and hosts like ticks and mosquitoes that can carry pathogens, the regional level where we see diseases move from urban areas and agricultural systems and natural areas. So when we think of these big health challenges, One Health is an approach that just brings together teams of people from different backgrounds and training and perspectives to be able to work holistically to tackle these big health challenges that can impact people, our pets, livestock, wildlife, plants, and the environments that we share.
And when you describe it, it really helps me think about it moves across all aspects of our land grant mission.
Yeah.
And we're having a lot of these things are really topical right now.
Mm-hmm.
We're dealing with a lot of things over the last 5 years, but then also currently associated with wildlife diseases moving into domestic species. And how does that impact our systems, and how does that impact the profitability for agriculture, especially in the state of Nebraska? So who are some of the key partners you work with, both in the ag and in the human and in the environmental space that you have in your network?
Yeah, so it varies. So we have a Nebraska One Health program, and the goal of the program is to build these teams, whether we're thinking about an infectious disease or some other shared health threat. And we try to bring together teams that are working on research approaches, on training approaches for our students at all levels, as well as outreach and engagement with communities who are often on the front lines of these big challenges. So to give an example, ticks and tick-borne disease are a really big concern in the state of Nebraska, and especially in rural communities where people are in close contact. We know that new tick species are moving into the state, and we know that new diseases like Lyme disease are becoming established in areas of Nebraska. So when we're thinking about a challenge like that, we have a big Nebraska tick network that takes a One Health approach, and we're very happy to have our program be working with other partners in that big network. And that includes people from across universities in Nebraska, both the NU system and Creighton University, but it also includes partners at the state level, so the Department of Health and Human Services, the Department of Agriculture, Nebraska Game and Parks Commission, and then in many One Health groups, we're also working with local public health departments or nonprofit organizations, and then directly with producers and communities themselves, because many of these challenges don't stay in the university. So even though we might bring together people from, backgrounds like human and veterinary medicine and animal science and agronomy and economics at the university, One Health really works to engage much more broadly with partners to think about how things are changing and how we can work together to address them.
So when it comes to other areas, say, for example, I've got some notes I'm thinking about. What is like surveillance and the role of surveillance of diseases play, especially kind of in that transition zone between wildlife and domestic species?
Yeah, I think that's a great question. So we know from the local to global level, there's a lot of concern about shared diseases. So a big one that has been in the news a lot lately and is on a lot of people's minds is highly pathogenic avian influenza, the H5N1 virus. Mm-hmm. So that's a virus that is hosted in wild birds, typically, especially waterfowl, but can cross over to domestic animals like chickens and cattle and can be present in agricultural production systems, and that can also not only affect the livestock and their production and their health, but it can lead to exposure to farm workers who are in direct contact. So we think about it at a lot of different levels. What's happening in the wild bird populations? What's happening in livestock systems? What's happening with human exposure, with contact with any of those groups? And then avian influenza, we can think about it, it causes really big problems in agricultural production, but it also has an impact globally on conservation. There are a lot of wild birds and animals like elephant seals that are having conservation challenges due to this. So when we think about all of those different spheres, we want to understand what's happening in the wild hosts. We want to understand how the spillover is carrying the virus from wildlife to domestic animals, and then how people might be at risk too, because we know that, influenza viruses can go from animals to people, but sometimes they can change and also spread from person to person. And so this is a beautiful example of the need for One Health, because again, no one person and no one research area can understand all those aspects. So by bringing together people who are working on human surveillance and domestic animal surveillance and wildlife surveillance, we have a much better understanding of what's happening in Nebraska, but what's happening globally that can influence local agriculture as well.